It gives me great pleasure as President of the Australian College of Nursing to welcome you to this event. Those of you virtually, unfortunately, can't enjoy the rest of us who are here, and last night was a particular buzz, and the number of people who commented on how good it was to actually be together was quite phenomenal. Let me start by acknowledging the Larrakia people as the traditional owners of the Darwin region. I'd like to pay our respects to the Larrakia elders past and present, and welcome any who may be present with us today. And I now know what Karen means about with the lights. It's quite dazzling. Now, I've been given a script that lasts for 30 minutes, and I have 5 minutes to speak. So let me just say that I have exercised my presidential prerogative, and I've slashed and burned, and I suggest that you put your seatbelts on because I'm going quickly, and Carly, do not have a heart attack because some of your best bits have probably gone. But you gave me 5 minutes. This is our 10th year of being the Australian College of Nursing. Many of you would be aware that we were previously two separate organisations, the College of Nursing and the Royal College of Nursing Australia, both of which were established in 1949. I'm not going to go through all the things that we've achieved in the last 10 years because that's been slashed and burned. I'm just going to pick a few highlights that I thought I could fit into the time. In 2016, we established the National Row Shows to connect with as many of our members as we possibly could. And as you know, for the last couple of years, there's been a bit of a hiatus, but we know why. And so those have not continued. But you'd be happy to know that they've started again, and so the ACN team may well be at a place close to you in the not-too-distant future. To create strong relationships through corporate membership, we also launched our affiliate program in 2016. We started with 2 affiliates, and today we have 119, and that represents over 150,000 nurses. Also in 2016, our first white paper was launched in Parliament House, titled Nurses Are Essential to Health and Aged Care Reform. It was launched by the then Prime Minister Malcolm Turnbull, and I'm told that there'd never been so many parliamentarians lined up to speak at that session, and I'll just leave that at, there's never been any more than that at any session. In 2017, we delivered our inaugural policy summit, which has now become a major event on the profession's calendar. And we also relaunched the Emerging Nurse Leader Program, which is for third-year student undergraduate nurses up to 6-year registered nurses, and we have set aside dedicated places for enrolled nurses. To date, we've received thousands of applications for this program, in part because of the extensive support that we get from all of you, our members, who have acted as mentors and assisted them in the program. And the program has now changed the landscape of nursing leadership. And in 2021, we were invited to share our program, the Emerging Nurse Leader Program, with the International Council of Nurses. In 2018, we introduced the ACN Health Ministers Award for Nursing Trailblazers, and she's following me, one of the winners. The first time in Australia, a federal minister has supported a nursing award. And we also launched that year our policy chapters, creating a platform to use our nursing expertise and experts to develop policy papers to influence government decision-making. Over the years, we've seen a dramatic increase in our position statements, white papers, and toolkits. 2019 saw us launch the Institute of Leadership, which has become the flagship for developing nurse leaders throughout the aged and healthcare systems. And building on our strengths today, I'd like to announce that as part of the Institute's growth, we're launching 2 new programs. So for all of those of you who've lobbied me about what are we doing about building research capacity, we are launching the Emerging Nurse Researcher Program. And for the Nurse Executive Group, get ready to cheer because we are also launching the Nursing Unit Manager Leadership Program. It doesn't take us long to get ourselves energized. You asked for it yesterday, and I'm announcing it today. 2019 also saw us launch the Nurse Strong initiative on the Today Show with a focus on nurses' well-being. And as those of you who are members know, we've given away personal training programs, mindfulness and yoga courses, and teamed up with Heart Foundation and other organizations. Our care packs have sourced products, many of which have been donated to us from bushfire-affected groups and regional and rural Australia. In 2019, we also established the ACN Foundation to fund scholarships and other initiatives to develop nursing leaders. And in just 3 years, we have tripled the Foundation's reserves, enabling us to give more back to Australian nurses. One of the initiatives of the ACN Foundation is recognizing our own heroes such as Lieutenant Colonel Vivian Bullwinkle, who will be commemorating with a memorial sculpture in the grounds of the Australian War Memorial, the only nurse and the only woman to be honoured in this way. We're also raising funds to establish 21 new nursing scholarships in the names of Vivian's colleagues, the 21 nurses who were also massacred on Bank Island. And I'd like to thank all of you who have contributed to the foundation. 2020 was designated by the World Health Organization as the year of the nurse and the midwife. And for the first time in Australia's history, we flew ACN's flags in front of Parliament House. We didn't get the nurse on the sails of Sydney Opera House, but I'm going to make that one of Kylie's KPIs for next year. So I haven't given up hope. We commenced our Policy Fellows program funded by the ACN Foundation, and I'm pleased to announce that in 2022 we have 7 fellows confirmed. And 2020 also saw us secure 3,000 registered nurse refresher programs for nurses from the federal government. And as enrolled nurses were not included, ACN provided $500,000 in funding to support them to actually achieve the same training. Internationally, we supported that year our Pacific Rim neighbours by providing graduate certificate education in critical care, largely funded through DFAT, but when there was a funding deficit, ACN donated hundreds of thousands of dollars so that 2 nurses in each of our 14 Pacific Rim countries could complete the course. We were also that year appointed by the Australian government to be the provider for the national immunisation training for all COVID vaccine providers, and to date we've trained over 250,000 professionals. Which is great, thank you very much. I'd particularly like to mention the Puggy Hunter Memorial Scholarship, which was established by the Australian government as a tribute to the late Dr. Arnold Puggy Hunter. It's designed to assist Aboriginal and Torres Strait Islander people studying at an entry-level course, and I'm proud that ACN has the responsibility of carriage for this scholarship as it contributes to closing the gap for Aboriginal and Torres Strait Islander Australians. Last year, we launched our strategic directions, Shaping Health, Advancing Nursing, for the next 5 years, which is underpinned by 6 pillars: advocacy, community, education, leadership, policy, and social impact. And we also rebranded our communities of interest, launching 17 faculties where members can work with like-minded members interested in a particular area of practice. So overall, it's pleasing to note that over the 10 years, I'm waiting for her ladyship to pop up, but she hasn't. Overall, it's pleasing to note that over the 10 years, our membership numbers continue to grow. We've increased nurses' representation on committees at state and national level by 6,000%. We've given evidence in many parliamentary and Senate inquiries and royal commissions, and our revenue and liquidity remain very strong, particularly during a period of global instability. So in closing, I wish to acknowledge our nursing colleagues in war, particularly in the Ukraine and elsewhere as it's getting, the world's becoming more unstable. Our thoughts are with them, and closer to home, of course, we know many nurses have suffered with COVID in the last couple of years whilst providing care, and others have, of course, had to step away from clinical work to care for others in their family. These next few days, as many of you have said to me, is the first time they've actually been away and had a break, and so thank you for sharing that with us here in Darwin. I hope you have a great time. I hope you get to meet new people. Network, it's the best place to network. If you want to ask anyone anything, bowl up to any of us and corner us in the corridors somewhere and ask what you need to ask. Most of the board members are here, and you'll see them tomorrow afternoon, so ask them questions. Embrace new ideas and go home recharged and reinvigorated. And I'm sure you'll enjoy our final keynote speaker, Georgie Carroll, who's going to make sure you all go away laughing. Thank you very much. She's now standing so I can sit down. Thank you.